just pull it out, yeah?
Let me say a few words by way of welcome to Downing Street, and thank you for Let me say a few words by way of welcome to Downing Street, and thank you for coming here today on what is a historic state visit, the first inward state visit for 37 years. And it was very good that His Majesty the King hosted us all last night for a most enjoyable dinner with you and your delegation. And it is really good to have you here today. The long and shared history between our countries is obvious and much valued by us, as is the people-to-people contact and engagement that we have and that enriches our lives here in the United Kingdom, as His Majesty the King mentioned in his speech last night. We have a lot of work that we already do on the economy, on defence and security. But today is the opportunity to take that to another level with the agreements that we've been able to reach on export and on business exchange. And I think that shows that our ambition is to go even further than we've already gone with our two countries. And so I really look forward to discussing those issues and wider world affairs as well. And thank you again for being here. You're most welcome.
Thank you very much. It's very been a great, historic visit, to refer to 37 years ago before the last one. And it was very, very touching. The Majesty of the King and you yourself being present last night, and tonight was a very fulfilling and historic one. And to strengthen the bilateral relationship between Great Britain and Nigeria, we cannot forget that institutional developments that we've enjoyed over the years.
Yeah.
In fact, my last residence was on Bodilon Street.
Oh, fantastic.
Look at those great history. And we need to much of the trade agreements, stimulate more economic relationship that will build our two nations. And Nigeria is currently going through a very strong reform of the economy. And other than the volatility that we will discuss that further in our bilateral discussions, what we are facing is not a small challenge. Currently, the entire world is challenged.
Yeah.
And Nigeria is not immune, so is Britain is not immune. I've seen your reaction on television to watching things as they develop. My concern is, as you rightly said, the economic and the welfare of the people, and how we should work together to improve the livelihood. I mean, so, mitigating the economic volatility at this point. And currently we are challenged in being the largest city in the West Africa, country in the West Africa region, and on the continent, challenged by terrorism and it comes from the Zaire and the conflict of climate change, all of that. We will be able to discuss it in our bilateral relationship and see what Britain can do to accelerate the friendship, partnership, and the collaboration.
Thank you so much. Thank you.
Thank you very much.
All right. Thank you.
Thank you very much. I was thinking. Okay. Yeah. So you can just tell me when they're done and I can wait for packing up and everything. Yeah, sure. Yeah, great. Yeah, that's good. Yeah, fine.
Lessons learned, because we are the people who die in pandemics. We are the people who are the most at risk.
And at the start of the statement, could you introduce yourself as well, just so we make sure we get your name right?
Do you want spellings and things?
That would be great if you could.
Yeah, that's fine. So do you know you do you? Yeah. My name is Lara Wong. I'm the founder of Clinically Vulnerable Families. My name is spelt Larawong.
And I'm Dr. Catherine Finnis, that's Finnis. I'm a Deputy Leader of Clinically Vulnerable Families and I gave evidence in this module.
This is a huge victory for clinically vulnerable people who are the most at risk from infections and clinically vulnerable families. CVF, for us, it's the first module we're involved in. Baroness Hallett quotes us at length and we're delighted that she's accepted our key points. The key point that we have made from the first preliminary hearing is that there is a fundamental misunderstanding of how COVID is spread. The Chair found 3 fundamental flaws that resulted in the UK government being wedded to an outdated and scientifically inaccurate way that the virus spreads. The result was that airborne measures were deprioritised, resulting in clinically vulnerable people being left unsafe in healthcare. We're pleased that the Chair has gone further and recommended that all new healthcare facilities should have effective ventilation and the short-term use of HEPA filters, which are portable, affordable and easy to implement. CVF keenly awaits clarification on how and when this will be implemented.
CVF were the first witnesses to wear masks while giving evidence to the inquiry, proving it is possible to communicate effectively and fluently while wearing a mask. High-grade masks are important safety measures for individuals. We are pleased that Baroness Hallett has quoted with approval from Ben Warren's evidence that there was no good reason to prevent patients from wearing face masks, and his important recommendation that more needs to be done to ensure safe access to healthcare for vulnerable people. CVF is pleased that Baroness Hallett has recommended that clinically vulnerable people need to be empowered in a future pandemic, and she recommends advising people at high risk on how to protect themselves, which she said will be vital in any future pandemic. Thank you.
Just so you guys know, we have got an airborne infection expert with us. He's Dr. I'm not sure where he's gone. If you guys have any questions for him, sorry, Dr. Adam Squires. He's one of the few experts in the UK. Does anyone have any questions for him?
Do you agree that the inquiry recommendations go far enough with regard to respiratory protective equipment, particularly as quite rightly said that it will not be restricted to procedures?
Yes, well, it certainly makes a very good point that focusing on this false dichotomy of quote-unquote aerosol generating procedures was the wrong approach, and that essentially there could exist an airborne risk at any point. And it's good that that was addressed, and that one of the ways to address it would be good advice on masking, better advice on masking, and the other way is through clean air provisions. I think it would be good, and it remains to be seen, first off defining what good clean air provisions means in terms of ventilation, in terms of HEPA, with specific numbers of how good, for example, CO2 measures weren't specifically mentioned, but hopefully will become part of the approach going forward. And the other one is specifying the responsibility to make sure that all healthcare locations become safe for clinically vulnerable people and everyone else. So cautiously, yes.
I'm chair of the COVID Airborne Transmission Alliance, and we're very keen that these recommendations actually lead to changes in leadership in the health system in the UK. Do you think that means we need to have completely new leadership?
That's certainly not within my area of expertise, I'll say. It's not. I couldn't tell just from the report who would have the responsibility, so it'd be good to see if someone does, but I think it's not really for me to say.
The report clearly identifies that nobody has responsibility or had responsibility, so it's very important we have somebody who is actually able and willing to make the changes required, surely.
Yeah, I absolutely agree with you. Do I go? Should I leave? Someone else want to go?
My name is Dr. Barry Jones. I'm chair of the COVID Airborne Transmission Alliance, a group of professional organisations and individuals. And the core of our efforts has been to achieve recognition of the airborne route as the predominant means of transmission of this awful virus called COVID-19. And having accepted that it is airborne, then making sure that the correct mitigations or protections are available to healthcare workers and also to the public, because we were all greatly deceived during the pandemic into being told that if we washed our hands, we'd be adequately protected. There are 250,000 fellow citizens who have died having not been given the right advice on how to protect themselves during this pandemic. And for that, whichever government has been in power is at fault. We hope that that will now be rectified as a result of Baroness Hallett's excellent recommendations. But we fear that things will not perhaps occur as effectively as she would hope. It's very important to us that there is new leadership and that the infection prevention control guidance is completely overhauled and reviewed without prejudice. And sadly, those who were in charge of it during the pandemic demonstrated a complete lack of imagination and ability to change anything and innovate and listen to the science. Government said it would listen to the science, but they were told the wrong science. So not surprisingly, it all went badly wrong. We should have done a lot better. And what really matters is, will we be better prepared for the next pandemic? We should be, if the government listens to Baroness Hallett's recommendations, which we thoroughly endorse, because she has vindicated everything that my alliance campaigned for during the pandemic. Thank you. Okay.
We've got James Telfer. Hi. Stand up.
Yes, James Telfer, COVID-bereaved Families for Justice. The Module 3 report is clear and utterly damning. The impact of the pandemic on healthcare systems, its staff and patients are devastating. Our healthcare system teetered on the brink of total collapse. Care was rationed, people who needed relevant treatments did not always get them. Our loved ones, many of whom were healthcare workers themselves, paid with their lives. That outcome was not inevitable. Years of austerity have left the NHS dangerously underexposed without the staff, beds or resilience needed to withstand a major shock. This was a political choice. When the pandemic hit, those in power failed us again. They failed to act early, they failed to follow the evidence, and they failed to respond with the urgency the moment required. Boris Johnson's refusal to demand and fund an extra 10,000 hospital beds as a second wave approached is just one example of the callous incompetence that characterised the government's response to the crisis. For many of our members, This is about how our loved ones died, often alone, without proper care, in a system pushed beyond its limits. And it's about the healthcare workers who are left traumatised by the government's incompetence. But this is not about past failures. Our health service is now in a worse position to cope with another pandemic than it was 6 years ago. And the current meningitis outbreak underlines why restoring resilience and capacity in our health system should be a matter of priority for those in power. It shouldn't take the deaths of our loved ones from COVID or young people at university to put health back on the political agenda. That's why what happens now is so important. This report must not be left to gather dust, and its recommendations should be the floor, not the ceiling, of the government's ambitions. We urge the government to use this report as a catalyst for change. Failing to do so would be unforgivable. Thank you. Any questions?
Can I ask, do you make of the finding that visiting restrictions for patients and life care should be facilitated as far as possible?
Yes, it was quite inconsistent. We had the luxury of visiting my mother. Many people didn't. And particularly at that point, you have people dying over video calls. The report recommends a standard procedure as much as is possible. We welcome that because nobody should go through that experience, both the bereaved and also the person who's actually died. You should not die alone.
You mentioned obviously the meningitis outbreak. Of course, it's an emergency of a different scale, but it is still an emergency.
Yes.
Do you have concerns that the healthcare system is ill prepared for that outbreak?
Well, again, the fact that they're now rolling out a wave of vaccinations to those who weren't previously given them because there was a choice not to necessarily vaccinate everybody for meningitis B. As you know, that again, that's a political choice the government has made not to implement something that could have been done. And again, these are all choices governments make, and they know what they could do, but they don't.
But what the meningitis outbreak illustrates is how our NHS has to be resilient to whether they're local shocks or national ones, and that needs to happen now and not wait till the next pandemic.
Yes. Planning, not reacting.
Do you think the meningitis outbreak we're seeing now shows the former recommendations and former reports potentially haven't been put in place yet?
Well, again, it was a choice not to necessarily vaccinate everybody for the same thing. So it was implemented in 2015 for babies, but not for the cohort that are older and now vulnerable. Any other questions?
Can I just ask, do you think it goes far enough? Are you happy?
The report?
Yes.
It's a digest of what has happened, but there could be more analysis and recommendations, particularly around preventing patients being affected by other patients. So it goes so far to talk about staff PPE, but what happens to other patients? Patients are not covered by HSE regulations, so there's a gap in the framework that manages how patients are protected from each other and infections in hospitals, which has, killed 10,000 people.
So the report is really strong in that it lays bare that the NHS did not have the capacity to cope with the pandemic, and in that sense it's a good report. It does not go far enough in what needs to happen now. So the recommendation talks about having surge capacity, but not capacity now, because as we know, patients are experiencing things like corridor care in accident emergency, which is unsafe. And so that needs to be addressed now. And in fact, the report quotes the Department of Health and Social Care as saying that you have to invest in healthcare in peacetime, as in outside of pandemic time. So that's what we're pushing for.
There's a lot to digest in the time we've had, so we've skim-read it, absorbed what we can do, but we have a lot more recommendations that could be implemented that we will be releasing as well.
good on diagnosis, further to go on the recommendations, and we have been and we will continue to hold the government to account to ensure that they implement the recommendations from previous reports and from this one.
Thank you. Okay.
Naomi, Naomi, last name Fuller, F for Frank, ULO, P for Peter.
James Telfer. T Tango Echo Lima, Foxtrot Echo Romeo. Okay. Okay. Yep.
Thanks.
You are first. Oh, that's your surname.
Do I just start? Do I just start? Okay. Somebody will give me a nod when you want me to start, will you? I'm Sarah Gorton from Unison, and I was a witness for the Trade Union Congress. We gave evidence for the healthcare unions representing the staff of the NHS. Okay, great. So for too many health workers, the day-to-day business of going to work meant putting themselves in harm's way during the pandemic. The report shows the devastating impact that working during the pandemic had on health staff from clinical and non-clinical backgrounds. The report is really, really stark in its conclusion that the healthcare service had been underfunded, and the level to which that critically undermined the ability of the NHS to cope during the pandemic. It's also really clear from the report and the Chair's very clear remarks at the start of it that it was only what she called the superhuman efforts of staff that pulled the NHS back from the brink, particularly during the first wave of the pandemic. So it's really clear that this report must be a call to action. She describes the fact that NHS staff felt as if they were undervalued and expendable, and that must never ever happen again. There is a golden thread running throughout this report about the impact of understaffing and chronic shortages and the limiting factor that placed on every single decision that was made. All of the options about managing the pandemic had to be constrained by the fact there weren't enough staff, there was not enough capacity. Decisions about availability of resources, so staff, equipment, protection in the form of PPE, the availability was more of a factor than precaution, and that's a thread that runs through the report. This must be a call to action for the government. Unions stand ready to work with this current government to implement the recommendations and make sure that no healthcare worker ever feels in the future that they are undervalued or expendable, and that there is enough capacity in the system, that staffing is increased to levels where not only can we just about cope with the pandemic, but it's not left for patients and for healthcare staff to deal with the long-term consequences on the system. Thank you.
Chief Executive and General Secretary.
Why did you wear a short?
We're just going to give her a
Oh,
quick mark and then
sorry.
we'll
Okay,
do
it's
some
alright.
questions.
I'm only joking. Thank you. Do you have an inside blazer pocket?
No, I don't.
You don't? Okay.
Sorry.
I'm just going to loop that around you there. Bear with me. And then I'm going to conceal that. Do you have any pockets at all?
No.
No pockets at all?
Sorry.
Okay. You good?
Yeah.
There you go, you can put that back.
Thank you. Sorry.
No pockets at all.
Sorry.
Okay.
Do you want me to hold it?
No.
Put it in my handbag?
You put it in the bag? Yeah, I guess so. I'm going to put you here so you're not tripping over. And I'm going to hide you there. You good?
Yeah.
Okay, there you go. Okay,
Right, that's it.
It's hard to think back to that time of COVID. First thoughts are to anyone that lost anyone during the COVID pandemic. But it also really focused our minds on the extraordinary sacrifice that nursing staff made. They were the lifeblood of organisations. And I think the report just reminded me personally of the extraordinary sacrifice that nursing staff made, putting themselves in danger in order to keep people safe. I can remember personally seeing when intensive care nurses who are used to looking after one patient had 4 or 6 patients to look after, feeling utterly devastated that they weren't able to give people the care that they knew they deserved. And scratch below the surface of nursing staff and you will see or hear the true horror of what they remembered and what they sacrificed. And I think this report brings that back today. Well, we went into the pandemic in England alone with 40,000 nursing vacancies. We already had 10% of the workforce vacant. There is absolutely no way we were prepared for the pandemic. We had to, as the report shows, rely on student nurses to be paid and give up their study time to look after patients. We absolutely had to rely on recruiting in from other countries international nurses during the pandemic when their own countries desperately needed nurses. Absolute disgrace. There is no excuse for not being ready for something like this. So to go into a pandemic with such a large deficit and then wonder why it was so difficult. And sadly, I'm afraid we've still got 24,000 vacancies of nursing in England. And do we see that investment and that preparedness at the moment? Absolutely not. And we can also know that post the pandemic, we have patients in corridors now. So actually there's a long way to go in order to in any way ever be prepared again in the future. So we absolutely have to get ourselves ready. It's heartbreaking to listen to those that didn't have the care they required that had COVID. But look at the thousands of people with operations cancelled, with diagnostics cancelled, and the slogan, you know, the public needs to save the NHS. Was that the right slogan? We should be able to cope so that the NHS can save the people, not the other way round. So there's a long way to go to get this right and make sure this never happens again.
Do you feel that the report and any of its recommendations, do you have confidence that it will affect change of that fairness?
I hope so. I think we're very good in this country at writing reports, but not always picking up the recommendations. I think the responsibility of any government is to ensure the protection of their populations, and that's across the entire UK. So I hope every government in every part of the UK takes this very seriously, because this cannot happen again in the way it happened.
How important do you think it was that the mental strain on staff was highlighted in the report as well?
I think it is important, and that's why I said at the beginning you scratch below the surface of many nurses. and it will come to the surface, and nursing teams. I don't think we've got over it. I think if you look at the report, there's a report in there, particularly for our critical care nurses, that talk the stress levels measured are very similar to being deployed to Afghanistan. I used to be a chief nurse in a hospital that had military nurses. If they've been deployed, they have 6 months light duties when they come home. Our nursing teams had nothing like that. Pandemic was over and straight into trying to catch up and look after the care of patients as soon as the pandemic was over. I don't think many teams and many clinicians have recovered at all, and I think they've had to stiff up a lip and carry on, which is why I say sit below the surface. The trauma of what they've seen will never be forgotten. I can remember personally speaking to a nursing team on a surgical ward who probably have one death every few months, 8 deaths in one 12.5-hour shift. That's hard. And when you've got to look at those nurses in the eye and ask them to do the same again tomorrow, that's been the reality. So I think the report and the recommendations show what needs to be done, but I have to be honest, the true experience and horror is very difficult to capture in a report like this.
Sorry, can you just sum up once again your reaction? Does this report go as far as
I think there's more that could be said and done, and even on those recommendations we have to make sure that we even do the ones that are there. My worry is that some reports sit on a shelf and then we don't do enough with them. They've talked about preparing for surge capacity. We went into the pandemic with 40,000 vacancies in England in nursing. We've still got 24,000. Are we really going to be able to both have the workforce and the surge capacity to make sure that we learn from what went wrong during COVID? At the moment, it's very difficult to see how we're going to be able to fully enact the recommendations. There's a lot that needs to change in order for that to happen.
Do you welcome the conclusion that whatever was being said at the time, the NHS was essentially in parts overwhelmed?
I do say that. I think it talks about the fact that, it wasn't overwhelmed, but in reality, many clinicians do not feel that they were able to give the care they given. And if you have to stop all elective surgery in order to look after COVID patients, stop diagnostics, I don't know what else is a description of overwhelmed if that isn't it, when you can only do one thing. So actually, when you've got an intensive care nurse that's used to looking after one patient because of how critically ill they are, and they're having to look after 4 or 6, that feels pretty overwhelming to me and overwhelmed.
But do you welcome the fact she goes basically to that position?
She does, and I've just listened to the testimony and I think it was very fair and captured some of the human side of the real patient and public and staff cost, and I welcome that. Thanks very much.
Nicola Ranger, Chief Executive and General Secretary of the Royal College of Nursing, for anyone who didn't get it.
Thank you. Thanks very much.
Good afternoon. I'm Tom Dolphin. I'm the chair of the BMA. I'd like to make a short statement, read from a prepared statement, and then I will take questions if there are any. Speaking on behalf of all the doctors who worked through the pandemic, today's module speaks most personally to the experiences of the human beings who were at the centre of the NHS's response. While Baroness Hallett says it's a case of semantics, it's good to finally have pushback against the narrative from some politicians that the NHS was never overwhelmed. As Baroness Hallett says, whatever word is chosen, the impact of the pandemic on healthcare systems, their staff and patients was devastating. Hospitals stopped providing most elective care and barely managed to provide intensive care. Very clearly, the NHS was not providing care in a way that patients expected or doctors knew that they needed for either COVID or non-COVID conditions. We're glad to see Baroness Hallett specifically recognise that the fact we did not see the NHS collapse entirely is due to the dedication, commitment and ultimately the sacrifice of healthcare staff, who she acknowledges ultimately put their patients before their own well-being and family life. Tragically, many, disproportionately those from ethnic minorities, paid with their lives. The impact on doctors and our colleagues was stark, as painfully recounted in this report. Staff had inadequate access to PPE, and even though supplies may never have run out nationally, as the report says, this will have been cold comfort to any doctor or nurse using a bin bag instead of a gown, or being forced to reuse flimsy surgical masks in the face of a deadly disease. Throughout the pandemic and since, the BMA has urged a precautionary approach, assuming that a new disease like COVID could spread by any transmission route until proven otherwise, something we're pleased to see in this report today. We should work on a worst-case scenario basis and not simply scrape by on the bare minimum. The impact on staff was not just related to their own physical risk, but the trauma and the moral injury suffered due to not being able to provide the care that everybody, or the level of the care that they needed. As colleagues recount in terrible detail, we were seeing a level of suffering and death that most had never experienced before in their lives at work. The cumulative impact of daily moral dilemmas was and continues to be devastating. As the report notes, by 2021, 2/3 of doctors responding to a BMA survey were suffering from a work-related mental health condition. 1 in 10 were experiencing suicidal thoughts. These effects live on, with 1/3 of doctors telling the most recent NHS staff survey that they are experiencing burnout. There's welcome recognition that the NHS went into the pandemic overstretched and understaffed. This hasn't changed. While there's a recommendation to put in place plans to scale up capacity in the event of a new pandemic, when we're running at our limits all the time, this flex cannot happen. The government has to go further and increase capacity in non-pandemic times as well. This means more staff and keeping and supporting the staff we already have. The report makes a number of recommendations, but we urge the government to look beyond just these and reflect properly on the full findings and the message they send about how both staff and patients were failed and what needs to change to stop this from ever happening again. Thank you.
Can you just give any sense of your personal experience during the pandemic or the experience of other doctors that you work with?
Reading a lot of the individual comments that people made that were quoted in the report, it really brought back the stark experience. I was working not far from here in an intensive care unit where we were extremely stretched. We had the kind of staff to patient ratios that the report talks about that meant that what we would normally think of as intensive care really wasn't what we were providing. We normally would expect to see 1-to-1 nurse to patient ratios in intensive care, for example. That was more like 1-to-4 most of the time during the peaks of the pandemic. That really isn't the level of care that we know patients need and that we wanted to provide. And that was really hard for the staff, my colleagues, nurses and doctors alike. All the staff in the hospital were really struggling because we knew that what we should be doing for the patients wasn't possible, and that was really difficult for us professionally and personally. But I think we still see that. People are really tired, they're exhausted. You know, you talk to people sometimes and say, you know, what if there were another pandemic anytime soon, what would you do about it? And people sort of make a look of resignation and kind of exhaustion, and as if they don't feel like they have the energy to go in through that again. I'm sure we would if it came to it, but the prospect of having to do it with the current levels of exhaustion and burnout really are quite demoralising.
Do you think the chair got it right with saying HOS were overwhelmed?
I think if you look at the levels of hospitals presenting, there was a thing in NHS England called CritCom, which is the level of degree of overwhelm of the system. There were several times when several hospitals declared CritCom 4, the most serious level, when resources overwhelmed is the description in the list. So, and for sure, there were many other hospitals that were struggling that didn't quite get to that point of declaring it. I think there were hospitals definitely that were getting to the point where they were unable to provide the care that patients needed. Any others? I think the protection of staff was something that wasn't done very well. We saw that in the last module as well. The amount of personal protective equipment that was available was really inadequate. Although the report says that although there were always some PPE available throughout the pandemic, there were certainly times when different hospitals ran out. We were getting to the point where some staff were wearing bin bags, where we were wrapping bits of wrap around our hair to keep, instead of a hat, because there just simply wasn't the equipment available there should have been. We ran out of drugs at some point. We were using drugs there shouldn't have been. That's less about protecting staff and more about general overcapacity for the system. I think there needs to be a lot more work done on preparing for the next pandemic, because there will be another pandemic. The NHS currently isn't in a situation to deal with another pandemic if there were one, because we haven't yet recovered from the last one, and we weren't really set up for that one, and we're now in a worse state because of it. So we definitely need to do a lot of work getting ready for that pandemic, and that will leave us in a better situation generally anyway, even outside of pandemic times, because we have more capacity, more flex, and better prepared staff, healthier staff, happier staff who are in a better state to give the care that patients deserve. Thank you. Okay, thank you very much.
It's a statement for the Northern Ireland bereaved families for justice. My name is Enda McGarity. I'm the solicitor for the Northern Ireland bereaved families.
Martina Ferguson. Katrina Mines.
We're here today on behalf of Northern Ireland bereaved families for justice. I'm here with Martina, who lost her mother during the pandemic and was a witness in Module 3, with Katrina, who lost her father and was a witness in Module 2. On behalf of the Northern Ireland bereaved families for justice, I want to express our gratitude to the inquiry and the feeling of vindication for some of the key points which the Northern Ireland bereaved families have long been raising. Some of the many points that were raised in the report were around how infection prevention and control guidance informed inadequate planning in hospitals, and the fact that asymptomatic transmission was not properly factored into those plans was a huge issue. There was a recognition around how visiting restrictions were inadequate and the impact that those had on families and the patients themselves in hospital. Martina has campaigned for almost 6 years for care partners guidance in Northern Ireland to be brought onto a statutory footing, which would give people in her position in future the right to access their loved one and care for them in such a scenario, particularly in scenarios where they have dementia or learning difficulties, which it was recognised in the reports is particularly acute. The issue of DNA CPR notices was discussed at length. We think this was a significant issue in Northern Ireland. Of the many Northern Ireland bereaved families who we represent, this was an issue that occurred across the vast majority of them. And we think that a deeper dive needs to be done on this in Northern Ireland. Robin Swan, the former Minister for Health for Northern Ireland, recognised that a full review of DNA CPR notices should be done in relation to deaths that occurred in Northern Ireland. We agree with that assessment. We think that should now take place, and there needs to be a proper deep dive into how those were conducted. We can't just take the words of those at the highest level of government. They were not the doctors who were making the decisions. They were not the bereaved families who were at the other end of the phone call, who have their own experience about this. And lastly, the Northern Ireland bereaved families have asked the First and Deputy First Minister to establish a local inquiry. Almost 4 years ago now, 4 out of the then 5 main political parties in Northern Ireland committed to a local inquiry to fill the gaps which would inevitably arise from the wider UK inquiry. They now repeat that call. There are gaps to be filled. There is evidence to be heard from more bereaved families, from people on the ground in hospitals. 70% of the deaths in Northern Ireland occurred in hospitals. So we now call on the First and Deputy First Minister to finally answer that question and fulfil their commitment to establishing a local inquiry. We will be meeting with them on Monday next, and we expect an answer to that long-standing request.
Thank you.